Hey, Team Biden. Hope everybody's doing okay out there. I'm Tommy Meyer, and today we're going to talk about Biden's healthcare plan. You can read all about Biden's plan on his website, joebiden.com/Joe's Vision, where you can also see all of his other plans. If you happen to be out of work, like this guy, and are looking for something to do, this is a great way for you to pass the time. Now, before I get into the plan, I want to start with a little personal story. You see, I started with healthcare because just like for Biden, healthcare is also personal for me. You see, I turned 26 shortly before Obamacare was fully enacted. I suffer from chronic depression, and I need medication to basically be able to function. Without it, I'm pretty much useless. When I turned 26, I was kicked off my parents' insurance, and I had to sign up for a catastrophic plan, one that didn't cover prescriptions. I forget how much I was paying for now, but it was way too little. I was paying way too much, and I was getting way too little. I had a good job, but the job didn't offer health insurance, and I couldn't really afford anything other than that catastrophic plan. So I had to go off my medication, and well, let's just say it did not go well. I really spiraled, and I fell into a deep depression that's had lasting effects on my life. I still feel the reverberations of it to this day. Now, as soon as the Obamacare exchanges opened, I signed up for a plan, and I got back on my medication, but a lot of the damage was already done. This may come as no surprise, but with the subsidies I was afforded, my plan from Obamacare was far less expensive and more comprehensive than the catastrophic plan I had before. I tell you this because I think it's important to remember that just how these policies affect real people. You know, we're going to get into a lot of numbers. I love numbers. I'm a big numbers guy. But just remember that behind each number is an actual human life. And it's not much of a stretch to say that Obamacare saved my life. So let's get going. Let's get into it. The first pillar of Biden's plan is to give every American access to quality, affordable health insurance. Now, to understand Biden's plan, you first need to understand Obamacare, also known as the Affordable Care Act. As mentioned earlier, the ACA allowed people to stay on their parents' insurance until they were 26. Before that, the age was 19 or 23 for college students. Obamacare also made it illegal for insurance companies to deny coverage or charge higher premiums for people with pre-existing conditions. This has given over 100 million people the peace of mind that they never had before. Because of the Affordable Care Act, roughly 20 million people have gained health insurance. Unfortunately, since 2016, the uninsured population has risen again by roughly 1.4 million. Biden's plan would build on the Affordable Care Act, covering more than 97% of Americans. That would bring us one step closer to universal health care. The most talked about part of Biden's plan is what's called the public option. I'm sure you've heard the term before. The public option is a public health insurance option, kind of like Medicare, that Americans can choose to buy, even if they get insurance through work. It would lower prices by competing with private insurance, and it would further reduce costs by negotiating directly with hospitals and healthcare providers, sort of like how Medicare does. It would also coordinate amongst all of a patient's doctors to improve efficiency. The public option would have no copays for primary care. Now, one of the big criticisms of Obamacare, and a place where I personally think that it's come up short, is the fact that it only offers subsidies up to 400% of the poverty level. That means that for a single person making about $50,000 a year, or a family of four making $100,000, there's no assistance. This has disproportionately affected middle income and especially older Americans. For example, for a silver plan, the average 60-year-old making about $50,000 a year would pay nearly a quarter of their income for health insurance. That's according to the Kaiser Family Foundation. Biden's plan fixes this by getting rid of that 400% cutoff. He would also make subsidies more generous by lowering the income gap from 9.86% to 8.5%. What that means is that nobody would pay more than 8.5% of their income for health insurance. And he would calculate subsidies based on the far more generous gold plan rather than the silver plan, which is what they're calculated on today. Now, one of the biggest successes of Obamacare, and what was responsible for the majority of the reduction in the uninsured, was the expansion of Medicaid. Obamacare offered states the option to expand their Medicaid programs to all residents up to 138% of the federal poverty level. Not only that, but the federal government offered to pay 100% of the cost of that expansion through 2016, after which it would gradually go down till 2020, where it levels off at 90%. Still, 14 states with Republican governors have refused the Medicaid expansion, denying coverage to about 4.9 million adults. Biden's plan would offer premium-free access to those 4.9 million adults. He would also offer states that did expand Medicaid the option to move their expanded population over to the premium-free public option, and he would automatically enroll all uninsured Americans making below 138% of the poverty level as soon as they interact with government institutions like food stamps or public schools or something. And that brings us to Section 2, provide affordable quality health care and a less complex healthcare system. First thing Biden would do is put an end to surprise medical billing. What surprise medical billing is when, say, you go to an in-network hospital, but you see a specialist that you didn't realize was out of network. Biden's plan would bar insurance companies from charging you out-of-network rates when you don't have control over what provider you see. Other ways that he would reduce costs by using the antitrust powers of the federal government to tackle market concentration. He would repeal the exception that allows drug companies to avoid negotiating with Medicare. And he would partner with low-wage healthcare workers to increase their wages and accelerate innovative solutions. And that brings us to Section 3. Stand up to the abuse of power by prescription drug corporations. To do that, Biden would limit launch prices for innovative specialty drugs that have little to no competition. He would limit price increases by drug manufacturers to the level of inflation. He would allow consumers to buy prescription drugs from other countries. He would accelerate the development of generic drugs, and he would end the tax deduction given to pharmaceuticals for money spent on advertising, which means that we would get no more of those weird Cialis commercials with people in bathtubs. Or less of the Cialis commercials. If you really like those Cialis commercials, you should probably vote for Trump. And finally, that brings us to Section 4. Ensure healthcare is a right for all, not a privilege for just a few. Biden is a strong supporter of women's reproductive rights. He supports increasing access to contraception. He supports a woman's right to choose and says he wants to repeal the Hyde Amendment, which bars the use of federal funds to pay for most abortions. He would also fight the restrictive state laws that are making their way through the courts and restore federal funding to Planned Parenthood. But we're not done yet. Biden wants to double the investment in community centers and continue to fight, as he did as vice president, for mental health parity, something that's obviously pretty important to me. But how's he going to pay for it? Well, he's going to pay for it by taxing long-term capital gains the same as regular income. Currently, it's taxed at 0, 15, or 20%, depending on how much money you make. This was our second largest tax expenditure in 2019, costing us $127 billion. That's billion with a B. He would also raise the rate on top earners to back up to 39.6% from 37%. Now, real quick, let's compare don't be scared. Let's compare Biden's plan to Trump's plan. That's actually hard to do because, you see, Trump has no plan. In fact, he doesn't have plans for anything. Seriously, the closest thing he has is his promises kept page, where some of the sections are comically short. But he does have a record, and we'll go over that briefly. As I said before, 1.4 million more people are uninsured since Trump came into office. He's tried and failed multiple times to repeal the Affordable Care Act. He ended cost-sharing reduction payments to insurers, causing premiums to rise an extra 20%. That's according to the Kaiser Family Foundation. He's still supporting a lawsuit to overturn Obamacare, including overturning the protections for pre-existing conditions. And finally, and probably most egregiously, at the start of the pandemic, he refused to open up a special enrollment period for Obamacare. So that's it. That's Biden's plan. When you're discussing this with friends or family or while you're phone banking, there's probably 2 points of contention you'll run up against most often. One's from the left and one is from the right. Progressives will say that it doesn't go far enough. They'll say, we need to pass Medicare for all so that we can be like every other industrialized nation. I would kindly point out to them that although Medicare for all and universal health care are often used interchangeably, they're not necessarily one and the same. Medicare for all is a form of universal health care, but universal health care doesn't necessarily need to be in the form of Medicare for all. Sort of like how a square is a rectangle, but a rectangle is not a square. So Medicare for all is for squares. Don't say that. You would lose them. In fact, there's no other country in the world that has a healthcare plan as expansive, as expensive, as generous or as centralized as Medicare for all. Most countries that have achieved universal health care have done so through a mix of public and private insurance, and that's basically what Biden's trying to do here. Now, from the right, you'll hear that it's too expensive, and you'll probably get the question, why should I be forced to pay for other people's health care? To them, I would point out that they're already paying for other people's health care. People are not being turned away from hospitals because they can't pay. That's against the law. Hospitals have to treat them. But what does happen if they go in and get treated and they can't pay their bill is that the hospital passes that cost on to the rest of us. That's one of the reasons why healthcare costs are so expensive. It would be far more efficient if we just made sure that everybody that goes into the hospital already has quality, affordable healthcare. So thank you guys for watching. Once again, I'm Tommy Meyer. I hope this video wasn't too long and too boring, and I will be back with another video as soon as humanly possible.